Before we start, I would like to acknowledge and celebrate the first Australians on whose traditional lands my colleague Jana and I at least are, and pay my respects to their elders past, present, and emerging. So, welcome to the very first plenary session of the RDA CODATA Data Systems, Tools and Services for Crisis Situations Working Group. Just a bit of housekeeping. You've seen this slide before, potentially. There is a collaborative session notes document. You can scan the QR code, I hope. Otherwise, we also have a link, tiny URL RDA P21 DSTSCS, which will appear on the bottom of each slide, but probably not be very big. For questions in the room, please wait to be handed the microphone. Otherwise, the online participants, of whom we have now 6, can't hear you. And online, if you have questions or comments, please type your questions into the chat, or you can use reactions, raise your hand to indicate you would like to speak. And then my colleague Nana will be making sure that you actually can say something. Okay, we have a fairly packed agenda. So this is basically the welcome section. Then we have a brief overview over the working group, where it's come from and where it's hopefully going. Then we have a short presentation on a mentoring program that Jana has been conducting. And I think it's also about one other mentoring program. Anyway, so the mentoring programs that we have, that we know about and that we might try to adapt for our working group. Then we have a talk by Francis about the UNESCO Toolkit for Open Science and this working group's contribution. And we have 5 very short lightning talks about COVID-19, earthquakes in Turkey and Syria, cyclones in Asia. That's actually a video from Ron Law in the Philippines, a brief talk about bushfires and the war in Ukraine. And then we have a video talking about the roles of scientific principles and LC principles in framing the working group's research. And hopefully we have quite a bit of time at the end to discuss some of the questions we would like to check with you and get your comments and feedback. And at the end, we'll do a quick summary and next steps. Okay, so the aims of the session are, first of all, to introduce the newly endorsed, like on Friday, RDA CODATA working group. We'd like to communicate what we want to do in the working group and get your feedback and your comments. We have a couple of potential use cases that we would like to propose, but again, we would like to hear if you have suggestions for others. So if you, if you want to suggest some others or provide some comments, have a chat about methodologies and hear your suggestions again. Talk about the working group's mentoring program, hopefully recruit new active working group members, and also ask your comments on who we should establish connections with in RDA, in CODATA, and possibly elsewhere that you might think we should connect with. Okay, so far that was the very brief welcome and introduction. Now I'll give a little bit of an overview over the working group, where it's come from and where we're at the moment. So the background, and I actually have only been involved from that informal meeting at RDA Plenary 20 in Gothenburg. So Virginia, Bodchak, Francis would know more about the background before then. But there was an informal meeting held in March at the last RDA Plenary. And the idea basically became to develop a working group. We then spent a couple of months, I think until about June, to develop the case statement for this group. And the intention is to establish an RDA CODATA working group, which is this one, and also a task group within CODATA. And the idea there is that the RDA CODATA working group will focus more on the technical aspects of data processing, data systems, tools, and services in crisis situations. And the CODATA task group will be focusing more on policy aspects. So the 2 groups are meant to complement each other. And prior to today, and possibly ongoing from now, there have been a lot of discussions outside of RDA and CODATA with UNESCO, with the International Science Council, the UK Health Security Agency, and others. We have a fairly extensive list in our case statement. But I don't know, Virginia, Bodchak, would you like to add anything to that?
Thank you, Stephanie. I'll start. To me, it is a partnership with many data scientists coming together to try and deliver something that we think would be really important. I know that Francis will share very clearly what we're trying to do, but it is this wide partnership we seek the support for this. So we're really pleased to be involved. Burchak, would you like to add something?
Yeah. Thank you. Thank you. I'm a statistician by training. I teach at university in statistics department, but I'm a disaster risk manager on the policy side for 24 years. So I see the importance and how it works in real, how much it's needed and how it works in the reality in practice. So it was my pleasure to be part. Thank you.
Brilliant, Burchak. Francis, do you want to add anything?
No, I just want to say hello, and it's nice to be here. I'm Francis Crawley. I'm the chairperson of the International Data Policy Committee for CODATA.
So, Stephanie, back to you, knowing that we're here to support you with enthusiasm, and your engagement from Australia is just magnificent. Thank you.
Thank you. Okay, so basically what we're trying to do with the working group is identify the digital tool needs and challenges that first responders, field workers, scientists, lab personnel, policymakers, national authorities and communities face during crises. And we want to focus on the data that is needed in the immediate crisis situation and for immediate decision making. So crisis situations, of course, are much broader than that, but we really want to focus on the immediate acute situation. We want to identify the requirements, the data services, tools, and systems. It's the wrong way around, sorry. Data systems, tools, and services requirements to achieve interoperable, high-quality data and easy to communicate information for crisis management. Identify the characteristics and attributes needed for the design, development, and deployment in crisis situations of data systems, tools, and services. For the reliable and effective collection, analysis, and dissemination of information, referring back to the data value chain. We want to map these to more general characteristics for research commons. So that's certainly a linkage we want to explore with the RDA GORC interest group and fair sharing. And we also want to develop a recommendation that specifies the characteristics of data systems, tools, and services required to meet the needs and address the challenges in crisis situations. So we have three major deliverables for the working group. One is an assessment of the digital tool needs of and key challenges for key stakeholders. So these include all the ones that I've listed before during crisis situations. We want to drill down in 3 case studies to describe these in specific areas. The current thinking is earthquakes, typhoons, and wildfires, or for Australia, it's bushfires. And we want to, but these are still under negotiation, so we can make changes or add some or do whatever seems reasonable and useful. And we want to develop a final recommendation, as each working group in RDA does. Ours is meant to specify the characteristics of data systems, tools, and services required by stakeholders in crisis situations. So basically, it's like a requirements document in a way. So the timeline and milestones, I won't go into very much detail. Today is the session. We are really starting up this group now that it's been endorsed. So we will, over November, start establishing monthly meetings. And we would also start to finalize defining the 3 case study areas. So now would be a good time to let us know if you think there are other case studies we should look at. We also probably in the next month or so will need to start defining the mentoring program in more detail, explore more liaisons with other groups and liaise with relevant activities in UNESCO, CODATA, OSCs, and RDA. And also we want to start work on the deliverable 1. So that's basically what we plan to do over the next little while. As you can see, there's quite a lot here. I don't think I'm going to read all of that out, but we plan to have the draft needs assessment document around March. And we plan to have the draft case studies probably around May. And I just noticed the date actually November 23 that should be March 24, not March 25, but you probably worked that out. And we plan to have a draft recommendation that we can share with the community for feedback about August, September next year. And to endorse the final, to submit the final recommendation for RDA endorsement around January 2025. Okay. So the working group status and next steps. So as I just said, we've been endorsed by the RDA Council. That happened on Friday. We've also successfully applied for RDA Tiger support, which will be a great help to us. And currently what we've been doing and what we want to focus on as well is active recruitment of new members. That might include early career researchers, but also mentors for the mentoring program and possible adopters of what we want to deliver. Discussions with a wide variety of stakeholders, that's basically ongoing, from CODATA, UNESCO, and a whole range of others. Yes, the definition of the mentoring program, the confirmation of the use cases, and starting the work on the assessment of the digital tools for the key stakeholders. That's basically where we're at this point. Are there any questions in the room or online?
None in the room at the moment, Stephanie, although I think people are looking very interested, which is great. Thank you for a lovely presentation.
Okay. Jana, are there any questions in chat?
There was one question I have answered. It's about where to find the slides and so on. So slides are available at the end of the collaborative notes.
Thank you very much. All right. Then I think I shall hand over to Jana for a short presentation on a student mentorship pilot program that Jana has run. Just let me know when you would like me to advance the slides.
Sure. Yeah, thank you, Stephanie. Yes, you can move forward. Yes. This mentorship program begins at the success of another mentoring program that actually Francis is more qualified to talk about, but for the completion's sake, I would briefly mention Francis and his colleagues, including Elif, in artificial intelligence and data visitation working group, had run a very successful formal fellowship program, and wherein the fellows were recruited, and they actually received mentorship, resources, and so on to address some very interesting challenges. I hope during discussion or even now, Francis would step in and speak about it. So this is a formal program that I'm not qualified to speak on this, but that may even be helpful to this current data systems and data tools and systems in crisis situations. So we can move to the next one. The next slide, please. Yeah. The mentoring program that I'm actually describing is in a much smaller scale. At the moment, it is a pilot. It's a pilot that is being carried out at the University of Technology, Sydney. And so we started fairly small. We had about three groups of students who are engaged in data science and innovation master's program. It's part of their master's project. And it's a 10-week project wherein they have actually taken some data sets and they're creating a case study based on that. And oftentimes for data science students, what it means is defining the problem and acquiring and pre-processing the data, developing models and validating the models and reaching a proof of concept stage. And so this is actually run in the transdisciplinary school, and several mentors are engaged in this, including yours truly. And it is the subject itself is coordinated by Dr. Antoinette. So we are working into this subject. So we can move to the next one. Yeah. So the three groups that worked on actually did very interesting studies. The first group took a data set and extracted sentiments from unstructured data. And the implication of this is to find implication is to find how, or to find the meaning of this meaning of this text in such as Twitter tweets and so on in a very short time, and determine the seriousness of the crisis, or what kind of help they could offer. And the next one, please. And the second one is even more interesting. It is actually an emotional analysis using generative AI, as well as a support system using a chatbot for a crisis situation. As in the first part, it identifies or determines a crisis. And then it actually takes the social media input, and it identifies a emotion that is associated with this crisis. And based on the level of emotion, a chatbot is being developed. It's a proof of concept that will offer some kind of recommendation or some support. And at the same time, the future scope might also involve actually more continued support and advice, as well as being linked to some kind of support system. So this is a second one, and here this again uses both the traditional natural language processing as well as as well as generative AI. That is the talk of the town right now. Next one, please. Yeah. And the third one is about detecting smoke using deep learning. And they have progressed to actually identify smoke and carry out some analytics. So it's an early detection of smoke. So these three teams have been working on it. So this is this is intended to be a pilot. So we wanted to check it out, how it would work. And the invitation is for other universities and other institutions to actually chip into this and expand this program through their existing offerings. So it doesn't require something new. It's actually working through or building these problems into their curriculum or into their projects. Next one, please. Okay. So at the moment, they are working on the data pre-processing and developing models, etc. And what does it bring to RDA or this working group is that it creates some case studies. And while working through this, one can also identify ethical, legal, social type of issues, as well as the fair considerations. And one of the requirement, in fact, the main requirement is not even how great the model should be, but it should actually conform to the fair and open science principle. So it means that they should create a transparent and a fair output that someone else could actually continue to work on. Next one, please. So this is hope to be as a nucleus for future work. And then we have also identified some existing PhD topics, PhD and master's research topics that actually closely aligns to this topic, including identifying, assessing, and estimating crisis types, knowledge management and social media in crisis situations, and decision support systems in crisis management, such as bushfire and so on. So these are this is just an overview. And so depending on how the group evolves, any one or more of this could be expanded, and we could delve into it further as the group dictates. Thank you. So at this stage, I'm happy to either take questions or pass on to the next speaker.
Thanks very much, Jana. We have probably a minute, but not more, for questions. if anyone has a quick one. If not, feel
I think
free.
we can roll. Yeah.
Yeah, I was going to say,
If there
not,
are any
please just,
questions,
yeah, if there are questions, please put them in the collaborative notes document, and we can, yeah, and I can respond there as well.
sure.
Okay, thanks very much. Let's move on to Francis. Can you're there with a microphone? Excellent.
Hello, Stephanie, and hello, Nana, and hello, everyone else. Natalie as well, who's very, very early in the morning for Natalie. It's wonderful she's here. And hello to everyone here. I have to say, Stephanie, Virginia, Bochek, myself, even Anne here, we all know this rather well. We've been doing this for quite a few months, trying to put together this working group. So we don't want to make it too boring either. We really want to hear from you, and we want to have some interaction with the audience. So there. I want to say something about what Nana just discussed is the fellowship work that he's done. Actually, Nana is the first one really to kick this working group off the ground by engaging his students and giving them, let's say, projects to do that would actually support and help us do our work here. I've never met Nana in person. I haven't gotten to Sydney. He hasn't gotten to Belgium, but he seems like a great teacher. And I think the work he's doing with his students as part of this, as part of like a fellowship, or at least kicking this off as a fellowship, is quite remarkable. So we will speak a little bit about the fellowship. Anne, who's here with us now, she will have a session this afternoon at 4 o'clock, I think, Anne, right? And she will be talking about fellowships there too, what they were doing in their artificial intelligence working group here. So I will say something about another working group that's related to this, but they are kind of in the same box in a way, or trying to do the same things here. I should try to situate this a little bit here as well. So Professor Murray, Virginia has been working at a very high international level. You will see that for quite a few years, with a lot of passion, trying to address crises around the world, before COVID, before the more recent crises there. And Professor Burchak has been doing this as well, also at a very high level, but also very much on the ground too, with the people, with the first responders, with the governments, working very closely, trying to do this here. And Stephanie and I think Nana too have experience in Australia with the bushfires and supporting them, especially within a data system here too. So what we tried to think about together was how we could use, let's say, the tools that RDA has, all the tools that they have, and how we can use those tools for responding to real life crisis situations. So it's really trying to make an application of the work that's RDA has been doing across many of its different working groups and interest groups and things like that, and trying to bring those into actual reality here. So this really started, I don't even think I need the slides too much, but this really started last year around this time at a meeting in Leiden in the Netherlands. And then we had a meeting in March this year at the UNESCO office in Paris. And we did that, and it was in the context of the UNESCO Declaration on Open Science. And within that context, we tried to understand, well, how can we use data policy to improve the application and the entrance into open science systems. And because we had been working on crisis situations, and because we are almost always looking at crises around the world, so one after the other so quickly, we thought, okay, how can we try to build on this? So let me go through these. Oops.
Stephanie will move the slides, not you. You need to tell the mic to move
sorry,
the slides.
Stephanie. Yeah, so Stephanie, maybe you could go to the next slide. And so that's the recommendation of open science, but also you can see here in the background to this is also a right to information in times of crises, access to information in times of crises, updated in 2022, and a global framework for open science in the face of pandemics that, of course, UNESCO did in 2022, working also with WHO and other organizations. And then the next slide, please. Thank you. So, so within our International Data Policy Group, which Anne and Borchak are members of, we had been looking at, well, what do we do with science policy, and what is science policy? How do we use this? And so basically what I understand science policy to be about, not just data policy, but let's say science policy, is as an area of public policy that's concerned with the policies that affect the conduct of science and research enterprises. And essentially that has two aspects. One is the rules that govern our own institutions, our own scientific engagements, or your scientific research infrastructures, and those rules that govern the conduct of science. But then from within, let's say from within science, within your university, within your research institution. But then there are also the objectives and rules that govern the application of science to public policy. And there's also policy that governs science itself. Science is not a completely loose, free-running enterprise. It's very well governed and it's very well directed by policies, as all of us know, who get grants for one thing or another to do things. So data policy and science policy and public policy all interact with one another, and all of them also want to influence one another. We as scientists, we want to impact public policy, and public policy wants to impact science too. It wants to say, well, this is what we want studied, and this is what we want evidence from, and also it will say this is what kind of evidence we will accept and we won't accept. You don't decide if you're producing a medicine which evidence you're going to say is sufficient for the efficacy of that medicine or that vaccine. Somebody else in Amsterdam at the EMA will decide for you. So the next slide, please.
Francis, we're running quite a bit behind, so it would be really good if you could stick to the finish in the next couple of minutes.
Thank you. That's me. So we'll leave the slides there because there are too many. So what we had the meeting at UNESCO, and we decided that we would, part of what the UNESCO's Declaration on Open Science, they also now have, let's say, a procedure or project to implement it, and they call that a toolkit. And within the toolkit, they develop different kinds of instruments that can help people implement open science in different ways. And one of those instruments is a checklist. Another one is a guidance, and the third one I always forget.
Fact sheet.
Fact sheet. Thank you. So, so we're putting that together. So what we're doing really with them is we're now working on a guidance for scientists for data policy in times of crisis to support open science, or supported by open science there. And what we thought was this is very much a policy thing. This isn't really with boots on the ground. It's not really getting our hands dirty too much. It's very much at a policy level. And we thought that it would be important to try to also have a working group that worked with the tools that are existing within data for addressing crisis situations. And that is what Stephanie explained to us, and also Nana explained, and what Virginia and Borchak will go on to explain this morning as well. So I'll stop there. Good.
Thank you very much. I'll just quickly skip through the slides. You can find the link to the slides in the collaborative notes document if you would like to look at them in more detail. Okay. Let's come to our set of brief lightning talks. We have one is a video, the others are going to be delivered live. So first of all, can I ask Virginia, please, to talk about the COVID-19 case study?
Thank you very much. So it's a great privilege to be here, and thank you, Stephanie, for all your incredible work. I am head of Global Disaster Risk Reduction in the UK Health Security Agency, and I'm fortunate to be a member of the CODATA Executive Committee at the moment. And it's by working with these people in Francis that we've looked so hard at the impact of COVID-19. This was one of the very first photographs of COVID-19 developed by our incredible laboratories in London, and we could understand in principle what was going on. This was in January 2020. But what does this mean? Well, COVID-19, next slide please, is something that became a public health emergency of international concern, and as a public health emergency of international concern called by the World Health Organization, it falls under the international health regulations, which are an international law that is legally binding to 196 countries within the WHO member states. It grew originally out of response to the pandemics we'd had in Europe for many, many years, and it was seen to be a critical system by which there was a requirement to report public health events in an emergency way. And it's been a hugely important tool that we've used. So on the next slide, you will see how the reporting has been working as of last week. So there has been global engagement in reporting, initially daily, but now weekly where required across the world, so that we know that as of the 18th of October, over 770 million cases had been confirmed cases of COVID-19, with very nearly 7 million deaths confirmed as being associated with COVID-19. What is so surprising is that over 13 billion doses of COVID vaccine have been administered across the world, and possibly that may be a very more accurate figure because we can actually count those figures rather than necessarily rely on reporting. But what is meant is that using this system, we were able to get an estimate of what was happening around the world and to see what worked and what didn't work. Well, there was a lot that didn't work, we know, across the world in trying to manage COVID-19. But what it has shown us is that it's really important that we look to the future. And this is one of the things that are being considered now. If you move to the next slide, Stephanie, there is now a huge piece of work that is going on pandemic preparedness, prevention, preparedness and response accord. And it is likely that we will have a new pandemic treaty that will come through, which will only address infectious and pandemic diseases. And we know that we live in a world of all hazards, and we must be able to respond to all hazards in times of crisis. And that's why we are seeking your help as data scientists to try and see what we could do to try and build the support that we need with UNESCO Open Science to develop data policy in times of crisis, facilitated by Open Science, to try and develop a global mechanism that might help to support such a system. Thank you.
Thank you very much. Thanks very much, Virginia. Any questions?
Yeah, good.
We'd have time for a brief one.
Yeah, we need to have a question here. So you folks have been very well behaved. You even listened to me, which is fantastic. This never happens at home. So I really appreciate that. Say something interesting, or say something not so interesting, please.
There will be a broad discussion in the end, right?
Yeah.
There will be a broad discussion in the end, so
Yep.
I would keep my questions and comments for that, if
Okay.
that's good.
Okay.
That's fine. Let's do that.
Gotcha.
So there will be time for that, right? Just to be sure.
Yes.
But,
Yes,
did
that's
you
the
want to say
plan.
something? Yeah.
Virginia, do you have some sort of contact webpage or address that is linked in the slide so that if someone wants to contact you, that you can directly do that?
Not on the slides, but all the information I've shown you does have links that are in the slides to use, so you can see the CODATA coming through. The COVID-19 data coming through on a weekly basis now. It's now no longer a public health emergency of international concern, so it's only reported weekly. But I think it's an incredible global achievement that we can see each country's reporting, we can see the data from each country, and certainly in the UK we could go down to even postcode information and regions, so we could get really detailed information to make sure we understood the cases, the deaths, but also the vaccination status of people in with good privacy controls, so that we could actually see what we needed to do in certain areas. So the data for us in the health domain was absolutely at the heart of our being able to implement this. And I hope that you might feel that it would be useful to see more on this, if that would be useful, Max.
Generally speaking, that's actually a good point. So can I please remind everyone, including our presenters and session conveners, to please put your names into the collaborative notes document with your email address if you can, so that people know how to contact you if they wish to do so. Thank you.
We have another question, Stephanie.
Yep.
Thanks. Virginia, you're talking a lot about the data that was reported in real time. Since we can learn by looking back, are you going to look at the excess mortality data and things like that as sort of a check on how the reporting went, and maybe look at gaining information about that, or making getting some useful insights from that as well?
Richard, thank you for your query. Mortality data, funnily enough, across the world is not ideal. The UK and the US have 100% reporting, but in places like China, they have about 4% reporting on mortality. So there's a real disparity across the world, which WHO reports on the numbers of mortality, numbers of reports on cause of death. And this makes it much harder for us to be able to do what you're looking at on excess mortality. So this is a global need to be able to improve all that. And that's one of the reasons why the UN World Data Forum that Stephanie has referred to as our target for taking this work forward to November 2024 is so critical, because that is where we can engage across the world with many of the UN member states and try to encourage the increasing uptake of birth and death data, so that we understand more about what these impacts might be. Thank you.
Could I say something to that?
Very
briefly, yeah. Richard, thank you very much, because I think so we could look now from the excess deaths and we can do some analysis from there. But another thing, one of the things that we thought was important with this working group that Stephanie has started, and also with what Virginia is doing, is we thought it was so important to collect data during a crisis, because you can't reconstruct everything afterwards. So where we fail, where we fall down during a crisis is something that's lost if we can't do it. So this is one of the things, and this is why we think these tools, these systems are so important to build, and to use the structures that we have, the structures that we are building, and now apply them into these situations, so that we have more robust data to work with.
Okay, thank you very much. I think if it's okay, we'll move on to the next brief talk from Burçak.
Hello.
Wonderful.
Thank
Yep.
you. Hi, my name is Burçak. Thank you for organizing the session. Super, from Stephanie and Nana on the other side of the world, and the participants here, and Francis, Virginia, and myself. Don't think that we're just here today. We are having regular Zoom and Teams meetings to set up the idea. One picture says a lot of words, say thousands of words. That's a photo shot that I wanted to show you from the after the Maraş earthquake, which happened on February the 6th this year, almost nine months ago. And as you said, just to wrap up, there's social data and there's technical data. Never underestimate the social data, and which needs to be addressed based, because every flat or every residential dwelling unit in this photo had an address and had people living in there with social characteristics, demographic characteristics. There's sociotech, social and technical systems are inseparable part of it. If you go to the next slide, please, where I have only one slide because I have 3 minutes to go. Stephanie?
Yep.
Next slide.
Can you see the next?
Yeah, on the board, yeah, screen. Connected and connecting data. So that is there to emphasize, like, we need data before to prepare and to prevent. We need data during, and we need data, of course, after the event. So you need to connect the sociotech data before, like hazards maps, spatial, and yesterday's opening session, remember, spatial data where you need the locations, and spatial data, especially on disabled, vulnerable groups, etc., etc. So it needs to come together. You need visualization. So lots of maps. The lady from the Esri yesterday, she showed a lot of maps. That maps needs to be there before something happens, and for not just for earthquake, for multi-hazard thinking, because there are 302 hazards that Virginia is working with the hazard information profile of the world data set. So there are more than 300 hazards that we can generate such maps, connecting maps before something happens, and we need them when the event situation is realized. We need them to be updated. We need the data to serve to the policymakers, the researchers, and on-hand practitioners. Real data, okay, it needs to be reachable. After almost 9 months, there's still missing data after the Turkey earthquakes. Like, we can't reach data. Researchers can't reach data. It's just like data, like how many pets are lost, how many children, there's still missing children in the area, how many buildings really got the total collapse, how many buildings really got the moderate damage, how many buildings just had the light damage. And universities, in one of the talks yesterday, I mentioned universities with big data centers, especially, is one option. It can be part of the solution where we can find access, provide data, store data to use and update it regularly. But we need to definitely make a good, strong stakeholder management with the private sector, NGOs, local governments, national governments. Leave no one behind, because it's everyone's job to interact, prepare, respond, and recover if a disaster happens. So I'll just give you one real example that I witnessed myself personally as a human story. I received on my mobile now is on my bag, for the 2 weeks after the earthquake. So starting from the morning of the 6th of February, for 2 weeks, I received hundreds of WhatsApp messages. So Twitter data, somebody showed, Nana showed, I think. So it is important. People reached out to me because I work with the local government and national government very densely on disaster and emergency policy development. They sent me WhatsApp messages to whoever, the ordinary citizens, the people that I know, if they heard there's a debris, and if their friends or colleagues or families have been buried under rubble, they sent me WhatsApp messages to give me the location of the debris, which I have no idea what the address meant. And I forwarded to my colleagues at the AFAD, Disaster and Emergency Authority of Turkey, in the central headquarters in Ankara, where they set up a room where somebody just entered the number of the addresses, locations of the debris, so that the field practitioners could get the real data and try to go and rescue them with less equipment, okay? The number of the equipment, cranes or personnel, was literally not enough at all, because the scale was so large. And that was real data. For 2 weeks, there was a data flow just to my mobile phone, imagine the others, and giving me the debris location and the number of people buried under the rubble, their profession, dentist, lawyer, doctor, medical doctor, academician, professors from the university in that city, in Hatay, for example. And I really suffered a lot seeing this, and like just the way that I could only help them is to transfer the data. I received data, transferred the data to the colleagues, I thought the experts, and then I couldn't follow it up. Yeah, that was amazing. For 2 weeks, I tried to cap the messages. So this is a real example. As a data scientist, if you can develop a way how to solve such problem, I think it would be a huge contribution to the humanity. Thank you.
Thank you very much, Bochak. That's hard for us who haven't been involved in situations like that, haven't been affected. It's hard to imagine, really.
Thank you. I don't think any questions in the room, so maybe we jump to the next slide.
Yep. Okay, so the next case study we wanted to talk about is about cyclones in Asia, and we have a video from Ron Law from the Philippines. Hopefully that'll work. Please let me know if there are any technical issues with it.
Good day. Thanks for the opportunity to be part of this critical discussion. I'll highlight our experience with cyclones in the Philippines and the importance of data systems, tools, and services in crisis situations. Asia and the Philippines face frequent and intense cyclones. Asia, in particular the West Pacific, is the most productive hurricane basin, averaging 25 tropical cyclones per year, with 15 to 16 of these becoming typhoons, which are the equivalent of a hurricane. The West Pacific also produces the strongest typhoons, called super typhoons. The peak season is generally April through December. So it is typhoon period in the Philippines now. Some cyclones make landfall along Asia's east coast and the Philippines. And the Philippines is prone to tropical cyclones due to its geographical location, which generally produce heavy rains and flooding of large areas, and also strong winds, which result in heavy casualties to human life and destructions to crops and properties. This is best exemplified by Typhoon Haiyan, the strongest typhoon to make landfall in recorded history, which devastated our country 10 years ago. Cyclones are destructive. They can affect many areas and cause deaths, injuries, and displace people, predisposing them to diseases. But with data, many lives can be saved. From detection, using data from satellite imagery, radar, and other measurement tools, we'll be able to note the formation of cyclones, their characteristics, the strength, wind speed, gustiness, how much rainfall will it bring, can it trigger landslides, their track or path, the rate of movement, meaning how fast they are moving, and the direction where they are headed exactly. Knowing much about the hazard and the science behind it makes a big difference. Data for risk assessment allows us to identify specific risks to people, properties, livelihood, environment. Drowning, it can have other injuries, landslides, destruction of crops, environmental pollution, etc. These are also related with analysis of population exposed to these hazards in terms of geographic location, meaning where they live, and other vulnerability factors such as health status, economic status, level of education, access to technology, and other factors. We also need data to look at areas of impact and communities that can be affected, and the timing of landfall of the typhoon and exit from our area of responsibility for us to determine the operational period for the response. For response, we need data to conduct preemptive evacuation. This has been proven time and again to save more lives, as affected people are directed to do evacuation and seek refuge in temporary shelters. We also use data to decide on prepositioning and augmentation of logistics, deploy appropriate response teams to where they are most needed. And finally, we use data to coordinate with partners, other government agencies, other sectors, civil society, to have synergy in response and avoid duplication to make sure we meet the needs of everyone. Data on cyclones is useful in health emergency and disaster risk management. We use it for communication, issuing early warning to our citizens, especially communities that will be affected. We use it for resource mobilization and service delivery during response. And data is also useful during recovery, learning lessons from the response experience, and implementing measures for better preparedness to the next ones. What are our data requirements during crisis situations? The government and the health sector need data to deliver on its mandate. We need data to fuel early warning systems. We need data to guide our response operations. We need data to connect with partners, and we need data to reassure our citizens. In crisis situations, as we learned in our response to cyclones, If we are to save more lives, a major requirement would be to have very good data systems from generation, collection, consolidation, processing, dissemination, to eventual use of data. This data system should include availability of high quality data that's also reliable. We also have to address issues on data integrity, protect data privacy, and fight misinformation and disinformation. And also, we need to do our best to make sure we're confident with our data and that it is trusted by the public. Finally, we have to develop our capacities for many things, from having multiple sources of data through different media coming from government, the private sector, and even civil society, faster reporting and transmission, detailed and disaggregated information, and capacity to do advanced data analytics and modeling capabilities. For this, the health sector needs to be guided by certain principles and standards of data management in crisis. The Philippines believes that ways ahead on data management in crisis should be agreed upon by all concerned stakeholders at the global and national levels. Therefore, we support and commend the huge work being done by this powerhouse group of data experts to make sure data is really transformed into a life-saving tool in crisis situations. Happy International Data Week, everyone, and thanks for your kind attention. Good day.
Oops, not again. Okay. Unfortunately, Ron can't be here with us, so it's probably yeah, we can't probably do any questions. I just very briefly talk about bushfires or wildfires in Australia. I also wanted to point out that my colleague Shada Hadabi, who knows way more about bushfires than I do, is online and hopefully can jump in if there are any questions that I can't answer. Okay, so one thing I wanted to talk about are the Australian bushfires from 2019 and 2020, which you may have heard about even outside of Australia because they were pretty terrible. During those fires, over 24 million hectares were burned. Nearly 3 billion animals were killed or displaced, and a lot of threatened species and other ecological communities were extensively harmed. 33 people died directly, and extensive smoke coverage, which was across very much of Eastern Australia, may have caused many more deaths. More than 3,000 homes were destroyed, and the estimates of the national financial impacts are over 10 billion Australian dollars, which is a lot. So after the bushfires, there was a Royal Commission into National Natural Disaster Arrangements, and that recommended support, among many other things, supporting better decision-making through the sharing of data. So I've just put out 2 recommendations here. Australian state and territory governments should prioritise the implementation of harmonised data governance and national data standards. And Australian state and territory governments should create common information platforms and share technologies to enable collaboration in the production, analysis, access, and exchange of information, data, and knowledge about climate and disaster risks. The situation in Australia around, for example, bushfire data is that a lot of the data is collected by state or territory, and it is quite hard to share data across state and territory boundaries because the standards that each state and territory uses are actually not the same. So there are discrepancies. One of the things that was quite evident in the bushfires was, for example, there was a fire danger rating system that in the state of Victoria had a specific rating, and once a fire moved from Victoria to New South Wales, it was a completely different rating. It was very hard to actually work out what was going on. So things like that really made it harder for the states and governments to work together, states and territory governments to work together. Just a couple of examples of things that have happened since then. So the Australian Research Data Commons, which Shada, Jana, and myself work for, kicked off a bushfires data challenges program addressing quite a few data challenges. And the organizations involved, this is an acronym soup, I apologize, are mainly research agencies, government agencies, and national collaborative research infrastructure facilities. So there was development of a data governance framework, a national fire history, a national bushfire simulation platform for research, data on health outcomes, data on species traits and distribution, and a lot of efforts on looking at fuel data, but this is a problem that hasn't been solved, and that actually has 3 different agencies working on it at the moment. Also, outside of RDC, there have been a lot of things. For example, these national bushfire simulation platform that I mentioned before, that was done by CSIRO. There's also an operations version of this, which is becoming available to people in the operational support of bushfires. There are several agencies developing real-time warning systems, and there's also an Australian fire danger rating system being developed also by the Bureau of Meteorology and AFAC. But except for those last 2, none of these are real-time, but they currently address standards and support the planning in preparation for bushfires. So there's quite a need for looking at real-time systems that actually work in the situation of an acute bushfire. And that's it from me. Shada, did you want to add anything?
That was great, but happy to take any questions.
Okay. If we don't have questions, we can move on to the final lightning talk. Is Francis still in the room? Good.
Hello, Stephanie. Yeah, thank you. Thank you.
Hello again.
Good. I think I won't use the slides. It will take too long that way. I will just say something about it. One of the areas of crisis, unfortunately, in our world is still conflict, geopolitical conflicts. And so one of the things that actually inspired the work is firstly the COVID crisis that Virginia and others were involved with, Anne as well, and also the work Anne did within RDA with a very large group on COVID here. But also the war in Ukraine, when that broke out, I somehow got involved with setting up a Ukraine clinical research support initiative. So I was involved with that. I just want to say, you know, the crisis in a conflict situation is, of course, very similar to, let's say, a crisis. In many ways, it's similar to a crisis in a natural disaster or even in a pandemic. You have the same kind of data, the same kind of information you need, but of course, you have a much more complex, let's say, environment due to the political tensions that exist and do exist. So certain data becomes more sensitive, not only personal data, but also, let's say, spatial data and geographical data and things like that becomes more sensitive. Demographic data can become more sensitive as well, but at the same time, that data becomes extremely important. For example, knowing where patients are. We have, 6 million refugees now here in the EU from Ukraine. So being able to, for these people, for example, to be able to have their healthcare records, much of which was not digitalized. So their healthcare records for people that were in clinical trials, to be able to get them care and treatment and moving them around like that, to be able to follow disease, for example, follow cancer will be extremely important here. So all these things are quite important. So we also wanted to just make sure that within our working group, we had attention toward the geopolitical crisis situations. We use Ukraine as an example, of course. Everyone has Israel and Palestine on their mind today. Everybody is thinking about Sudan or other places in the world as well, where there's these crisis situations. And if only from the humanitarian perspective, it becomes extremely important to have rich data, the data that's needed. So thank you for that.
Thanks very much, Francis. We have one final video, which is going to be a little bit over 5 minutes. So I would suggest that we do that, and then we open the floor for general discussion.
Hello, this is Dr. Ekmekci, and I'm going to present on the roles of scientific principles and ELSA principles in framing our working group's research. But before going deeper into these principles, I would like to say a few words on ethical issues in crisis management, because these are very much closely linked to our working principles. The main ethical issues in crisis management are allocation of scarce resources, protection of vulnerable populations, communication and transparency, including infodemics, echo chambers, and epistemic bubbles, protection and endorsement of human rights, again, including the right to adequate, reliable, and timely data and information, good governance, and principles such as accountability, transparency, and responsibility, privacy and confidentiality of individuals and populations, data protection, data integrity, responsible conduct of research principles, and cultural sensitivity. So the role that ethics play in crisis management is even greater than most of us imagine, like guiding the decision-making process and ensure that it is just, fair, and responsible, prevent discrimination, bias, and other forms of unfairness, consider the needs and interests of all stakeholders, including and mostly vulnerable populations, and ensuring that decision-making processes are transparent, accountable, and based on reliable data and scientific evidence. Maintaining a sustainable data provision is another layer of ethical issues on top of what I have already been talking about. In crisis times, maintaining the sustainable data provision is problematic because data sources for the people who are responsible for data management may be affected by the catastrophe, and as a result, blockages in data flow can occur in a time that data is urgently needed. Another issue that makes the flow of data challenging is interoperability of data. The lack of a uniform format that makes the available data interoperable, especially in crisis times. Data is used by various actors, and if data is not interoperable, it cannot be used. Good governance is another huge cluster of ethical concern, because even if the data is reliable, justifiable, and interoperable, some rights and values may be overlooked in times of crisis while we are obtaining the data. If good governance principles are not applied, sustainability in science and also sustaining the trust in science and authorities would be hard to maintain. Scarcity of resources and need and demand for existing resources are increasing crisis, and the lack of access to some of these scarce resources pose threat lives and increase likelihood of irreversible damages. That is why communities should be aware of the fact that in a crisis, the resources will not be enough to meet all the needs. And also, people should be aware that if some sacrifices are needed regarding the allocation of scarce resources, the decision-making process will be science-based, and that this system is based on good governance principles. Generative AI, vast use of AI and also generative AI, either as a sole tool or as a decision support system for the provision and data analysis is another layer of ethical issue on top of what I have been already about. Risks and threats posed by either use of generative AI are amplified in crisis because of information, data integrity, and scarcity problems. Generative AI has the power to distort the truth and amplify biases, therefore it may pose significant threats in policies. That's why we should trust that data integrity, scientific evidence is by reliable data in line with responsible conduct of research principles. The good governance principles are in place, ethics by design is maintained, and the authorities decide based on scientific evidence to fortify the feeling of justice in society. So this slide, together with my next slide, mainly list the principles that we consider in our working group. We know that complex and interrelational ethical, legal, and social implications arise between practices, people, authorities, and users and developers of technology during crisis times. And also that there is pervasive informatization of crisis management and response. There is the essential role of values such as humanity, solidarity, equality, trust, and dignity, and a wide range of social, societal, organizational, and policy-related factors should be taken into account while we're thinking on values and LC in emergency situations. All partners and all stakeholders who are taking place should be aware of how values, ethical practices, and laws play out in real-life situations by creating design processes that closely mimic real-world situations and ideally integrate design work directly into those real-world settings, and coordinating across various areas of expertise and bridging cultural and political differences. And this brings us to the end of my presentation. Thank you for your attention.
Okay, that was a great video. We would like to open the floor now to general discussion. So we have a bunch of questions here. Now these are pretty many. Doesn't mean we have to discuss all of those, but we would really like to gather your thoughts on what we're proposing to do in the working group, on our objectives and deliverables, whether people in the room think they make sense, so get a bit of a sanity check. What should we change? Would you be interested in deliverables like that? Who would they be relevant to? Would you be interested in adopting any of our deliverables? So work with us during the development of the deliverables and make sure that they, in the end, meet your needs. Does everything sound feasible? And in particular, would you be interested in joining us to work towards our deliverables? And then we have another bunch of questions around the other things we've talked about. So suggestions for methodologies we could apply, use cases we should consider, and in particular suggestions for other RDA or CODATA or any other groups that we should connect with, and any other comments or suggestions. Now that's a lot of stuff. We invite you to also put any comments that you would like to make into the collaborative notes document. So we may not get through all of these questions, and you may have others that you would like to raise. But I think let's get started and see where we go from here. So any comments from the room on any of those, or anything else you would like to say?
We have a comment. Can you introduce yourself so we know who you are?
So this is Bernd Resch speaking from University of Salzburg. Thanks very much, and that's a very impressive effort. I just have a few inputs. It's a very broad topic, and what I'm going to say is touching upon let's say a lot of the aspects you mentioned. So background, I've been working in disaster management projects for like 15 years, including, like from a research point of view, right? Including refugee movements, including epidemiology, and mostly including natural disasters, of course, around flooding, fires, and earthquakes. Now, from a number of projects, what we always do is that we conduct a survey of user requirements. So those are, let's say from our experiences, quite homogeneous actually, is repetitive. So I think many of them can be generalized, and I would be more than happy to share them. And the same, by the way, concerns ELSI aspects. So for civil safety research in Austria and Germany, what we have to do is that by definition, we always have to have a sociological partner. We have to have legal partners, and that's legal research really, like to put things into context with data protection laws, GDPR and things. So everything we do is let's say evaluated to this degree. And what I'm mostly talking about is analysis of geosocial media data, drone data, and satellite imagery. So that's mostly but not only. As Francis mentioned before about systems, I guess you know that quite a bit of these systems exist, like EFIS and EFAS and the Copernicus EMS and so on, right? So there are quite some repositories, I guess, that can be used. And then there is the procedural view. So what usually happens is a devastating disaster happens, everybody sees the need for a change because things didn't go well, and then not much happens. And that's mostly a policy-making issue. And secondly, and perhaps even more importantly, this is an issue from the disaster management process, really the people in the crisis management board. Because what they do when they are stressed, like dozens of people have died, what they revert back to is they drop things on the wall, right? They do not use digital tools. And 5 months ago, we had a quite large disaster management exercise here with like 900 action forces, including derailed trains and collapsing buildings and flooded houses and helicopter rescues and everything. And the deal was they could do whatever they want, but they had to use the digital information that we provide them with. And that's something they don't want to do. And of course, standardization is a big one in there, as you know. How does information get from A to B between institutions, mostly between countries, even more importantly? Because currently what people do is they call up people on their private phone because they know somebody in another country, against all hierarchies and let's say communication paths. XAI is a big one, just because it was mentioned before, right? So how do we bring the result to the people? We can always tell them we have, this layer and this layer and this layer, like we have 20 different information layers. They're not going to use that. What they say is we want to have red or green, and that's it. And that's for every complex analysis that we do, which is always hard to abstract. What we cannot do, I think, is to tell, look, we have a great solution, please use it. It's not going to work. That's not the way. And as you asked for connections, perhaps one good one would be the PSCE, if you haven't talked to them, the Public Safety Communications Europe, which originated from a European Commission project, FP6, I think it still even was, which is an association between industry, disaster managers, public authorities, and of course researchers. And one of the larger projects we just started as well, which is Horizon Project 12 million, which is the TAMA project, which deals with many of the issues that you have mentioned as well. So just as a very brief overview, happy to catch up on that.
Thank you very much. I think it would be great if you could join our group as well, and share some of the things that you've talked about with us. That would be great.
I'm Anne Cambon Thompson from CNRS in France, and a medical doctor by training. And that, as such, that I have a comment, and it's about the presentation on COVID and WHO. And I was wondering, as we had yesterday a session on reliability of data, how much reporting data on number of deaths, number of cases, all these, which actually are relying not on digital tools that register by themselves, but by human reporting, are actually reliable. You'll never change a medical doctor who thinks that trying to save a life is more important than reporting one death more. And so this is just to illustrate how reliable are the data.
Thank you very much for the presentations. My name is Adugo Isaac, and I work with CABI, and I came in from the United Kingdom. So a lot of the things that you shared today resonated with me, especially given the projects we've been working at CABI. And one of them is, when you say there is social data and then there is technical data, a lot of the work we've been doing is around, the social aspects that will unlock data management and practice. And we have this framework that is called, that we call the FAIR process framework. I'm sharing that later today. And, it talks about that whole social aspects that prepare you to actually collect data. And in terms of the use cases, I wanted to ask if we have, case studies that we could share, for you to check out. How do we share those?
Thank you very much. We have a question or a comment from our online participants. So Adam, would you like to unmute and speak?
Hi everyone, from the UK. So my name's Adam Bilesmoor. I'm currently working at JISC. A long time ago, and I continue to have interest in I guess a related field. So I used to work on memorialization. I particularly had family links and contacts in Rwanda. And before that, I also worked with Holocaust memorialization. And I wonder if there's similar lessons and data stories to look at there. So there's post-crisis data and post-crisis, post-event data that has been like worked up around this kind of needs. Similarly, I worked on a project looking at harmonization, and that was raised in one of the case studies about how important it is that kind of the same kind of ground truth is used. So I worked on a project where we were looking at making sure that the GIS truths were shared across borders. So we had Alpine Rescue that needed to have like the same apps. Basically, agencies from one side of the border were being sent on a rescue, and they weren't necessarily arriving at the proper site for a rescue because they were transferring coordinate systems whenever they went across. And I think some of the data systems that we currently have can be really useful in helping to transform to make sure that there's a set of ground truths for coordinating those things. And finally, there's a lot of work on kind of citizen data. I've put the framework Shahidi, which I don't know whether or not people are aware of, but it's a really great kind of way of coordinating from the ground up. And I think some of the needs of coordinating stuff, which can be shared across the platforms, would be really helpful here. I've just added myself to the group. I think it's important that when we think about the kind of ways of coordinating tools and infrastructure, we don't forget the kind of ways of getting information and data from the ground, as well as coordinating the crisis actors themselves. Okay, I guess the final thing I would say, if people are coming into this group and don't have experience, that I guess the most important thing is when you're working with this stuff, be kind to yourself as well. Okay, thanks.
Thank you very much. It's a great comment. Do we have any more questions or comments from the room? I can only see one chair at this point, so I don't really know.
Yes, if I may. I'm Arne Bartke. I'm at the University of Salzburg. I'm a statistician, data scientist by training. First of all, I applaud you for all these efforts, which I think are really important. With regard to the data, and some of it has been already touched upon, when there's a crisis happening, then people look for the data that's readily available, and often there's a lack of a critical appraisal of how good the data actually is for answering the question that is at hand. And we as statisticians, and I think you're a statistician as well, right? Yeah. So we like to structure the data and see, well, there is some data that's available, like the real world data, that needs to be critically appraised, and sometimes it's really useful. Then there is really high qualities, for example, surveillance data, like after the COVID pandemic, we kept doing the wastewater monitoring because we thought it's low impact. I mean, it's very uninvasive and it's high quality and it's standardized. And for many situations that is possible. I mean, you think about what is possible and then evaluate how good it matches with the real world data. And then for specific questions, there are sometimes small but highly valuable data sets that need to be obtained for a specific situation. So we like to structure that way. And then the real impact can be obtained if different data sources can be combined in a smart way, which we have tried to do also with different projects here, combining hospital data with vaccination data and so on, to get some answers to real questions. I mean, how much does the vaccination really help? And that's complex. And yeah, I mean, happy, like many others, happy to contribute to what's been done here. There have been efforts where I've been involved. We had a conference, international conference a year ago, Science for Resilience, as sort of a post-pandemic conference, and involved also folks from the Australian Statistics Institutes, which they have mapped out some ideas. So maybe some of you know those folks, but yeah, happy to also bring that network into this game. Yeah.
Just thank you very much. Just to clarify, that's the Australian Bureau of Statistics, ABS.
Dennis Trevin, Nicholas Jewell, I think were the names. And one of them was, yeah, the National Bureau and also the National Association of Statisticians. We were linked with both of them. They've made some proposals. They said that they have been largely ignored by the Australian government back then, but they made some great proposals.
Okay, thanks very much. We'll have to have a look at that.
Hi, everyone. My name is Niels. I'm your liaison at the Technical Advisory Board at the RDA. So nice meeting you. I've been informed recently as well. I see there's a question, what other RDA groups should we connect with? Maybe that's something that we as STAP can help with, including, I think there's another interesting question, like what kind of profiles you're searching to join the group. Yeah, maybe it's something that we as TAP can help with. Just to comment.
That would be great.
My contact details are in the collaborative notes.
Wonderful, thank you very much. I was actually wondering about our TAP liaison. I may have missed it in Bridget's email, but that's great to know that we have one. And yeah, happy to work with you. That would be great.
Stephanie, I think we've got through our questions here, unless anybody else has another question. No, I think we've done incredibly well, and we're almost running out of time.
Okay, let me just go to our final slides. So first of all, we want to thank everyone, the presenters and everyone who's participated, come to join our session at some inconvenient times for some people. So I just wanted to put up the link here. This is the group page, and you can find, as Jana said at the start, you can find the slides in the collaborative notes document. You can join the working group. This is the direct link, but you can also join us from the group page. And there seems to be a wealth of information and knowledge in the room and of experiences that you could share with us. So we'd really love to see more people join the group. And that's basically it from me.
Stephanie, thank you so much from the room. Berchak and I are still here. But I think what is exciting is there's so many people we now want to go and talk to in the coffee break to catch up with you all. I just wanted to remind you all that we have an incredible UN landmark agreement of 2015, the Sendai Framework for Disaster Risk Reduction, and it does call for data throughout the whole document that the UN member states have all adopted in 2015, and it will run to 2030. And supporting this work, Stephanie, is really key to deliver some of that work. And there are many groups that we work with in national groups, but also in UN groups and many other places that are trying to do this work. So to have the support of data scientists and our partners who are in the room will be really critical in trying to deliver something that should make a global step forward, not a solution, but a step forward using the UNESCO's incredible work on open science, on data policy in times of crisis, at least as a checklist that might help policymakers with a brief fact sheet, some guidance for policymakers, some guidance for scientists, and some guidance for implementers, just might be a step forward on the process of what we see as a really troubling future ahead. So let's see if we can all do it together. It would be wonderful to have your support. Thank you, Stephanie. Thank you, Nana. Thank you, RDA, for all your support. And we know that CODATA is very anxious to take this work forward at a global level, so your support will be so much appreciated. I hope that's a useful little conclusion, Stephanie, but I dread to think what time it is in Australia, but it's just amazing you and Nana are here. Thank you.
Well, it's only 7:30 in the evening. It's perfectly fine.
Okay, that's a change.
The real hero is Natalie, who joined us at 3 a.m. in the morning.
Thank you, Natalie. But thank you so much, and it's a wonderful opportunity. Berchak, do you want to say anything in conclusion?
I'm good. I'll just echo you and thank you. And see you in the coffee break.
Thank you all so much.
Thank you very much.